Is there a genetic component to chronic fatigue syndrome diagnosis? Have you ever wondered if genetics play a role in chronic fatigue syndrome? Current scientific understanding suggests that there may be a genetic component contributing to the risk of developing chronic fatigue syndrome, also known as myalgic encephalomyelitis. This condition is complex and multifactorial, characterized by persistent, unexplained fatigue and various other symptoms. Research indicates that genetic factors likely influence susceptibility to this syndrome. However, it is essential to note that environmental triggers, along with immune, neurological, and metabolic factors, also play critical roles in its development. Family studies have shown that chronic fatigue syndrome can cluster in families, suggesting that heritable factors may increase vulnerability to the illness. Genetic research has been exploring variations in genes related to immune function, inflammation, and energy metabolism. However, no single gene or mutation has been conclusively linked to chronic fatigue syndrome diagnosis. The genetic contribution is likely polygenic and complex, meaning it involves multiple genes with small effects rather than a straightforward inherited mutation. Unlike some hereditary diseases that have clear genetic markers, the diagnosis of chronic fatigue syndrome remains clinical. It is based on symptom criteria rather than genetic testing. Ongoing studies aim to identify genetic variants that may predispose individuals to chronic fatigue syndrome or influence the severity and patterns of symptoms. However, these findings are still emerging and not yet definitive. Understanding a genetic component can help explain why some people develop chronic fatigue syndrome while others do not, even when exposed to similar environmental stressors or infections. It is crucial to emphasize that genetics alone do not cause chronic fatigue syndrome. They interact with other biological and environmental factors. In summary, there is evidence supporting a genetic influence on the risk of chronic fatigue syndrome. However, no established genetic test currently exists for diagnosing this condition, and diagnosis remains based on clinical evaluation. Research continues to explore genetic contributions to improve understanding, diagnosis, and potentially treatment in the future. If you suspect you may have chronic fatigue syndrome, it is advisable to seek a comprehensive medical evaluation and management tailored to your individual symptoms and health status.